When it comes to COVID, there are two things doctors are keeping an eye on right now: viral rebound and reinfection. This after the president went back into isolation after testing positive for COVID once again following a recent negative test. NBC4's Karina Chung spoke to local infectious disease doctors and what they want you to know. Karina.
Sierra, doctors say it's important to know the difference between viral rebound and COVID reinfection. This as several Ohio counties are facing high levels of COVID-19 and seeing more cases. Rebound versus reinfection.
With reinfection, it means that you've recovered from COVID in the last 90 days and then you have gotten COVID again. That's reinfection. Rebound is within that same course of the illness, and you have the virus comes back.
Doctors Madi Sabani with OSU Wexner Medical Center and Dr. Joseph Castaldo with Ohio Health says it's important to know the difference between the two. The White House says President Joe Biden is currently experiencing viral rebound after treating COVID with Paxlovid, the COVID-19 pill.
Whether it be 7 or 10 days later, symptoms return, or in the setting of the president, symptoms did not return and people are retested and they have a positive test again.
Castaldo added people who rebound are considered contagious. Doctors are also worried about reinfection. They say if you had COVID earlier this year, you could get sick again and test positive because of the BA.5 variant.
When you get a test done, whether it be an antigen test or a PCR test, you don't know what variant you got infection with.
They're urging communities to remain vigilant when it comes to COVID and protective measures like masking and testing.
We saw what happened in the Delta wave, and so really that's why if you do get reinfected, the vaccines do a much better job of protecting you, especially if you're up to date on your vaccines, including boosters.
Doctors say the COVID-19 pill Paxlovid is still a good treatment to keep patients out of the hospital. They say more real-time data is needed to know how many people could be impacted by viral rebound in the future.